While Class 1 antiarrhythmics featured a lonely soloist, Class 2 antiarrhythmics will be embodied by the sweet harmonies of the beta brass duet. Like sandpaper and silk, like heart and soul, I present to you Louis Hartstrong and Beta Fitzgerald. That's right, we got the world-famous duet back together for one night only, for this benefit concert to save the Beta Brass Club, once the heart of the jazz scene in New York. Beta Fitzgerald will serenade us with her mellifluous voice as she plays the keys, and Louis Hartstrong, he'll sing the harmony on those jazzy, syncopated beats. Notice that Louis is setting down his muted beta-shaped bugle as he starts to sing. A muted beta bugle is our recurring sketchy symbol for beta blockers. Recall the Beta Brass Symphony sketch where we illustrated the many uses for beta blockers. In the back of the music hall, we included a record player symbolizing their antiarrhythmic properties. Many of the beta blocker drugs first introduced to us at the symphony can be used as antiarrhythmics, including those A-beam cardioselective beta-1 antagonists, such as esmolol and metoprolol, the non-selective beta-1 and beta-2 antagonist drugs, such as propanolol and timolol, and the drugs with partial alpha antagonist properties, such as carvedilol. Beta blockers differ from most other antiarrhythmic agents by not directly modifying ion channel function. Rather, they prevent the arrhythmia-promoting actions of beta-adrenergic stimulation. Sympathetic nerves increase sinoatrial node automaticity by increasing the pacemaker currents, which increases sinus rate. Sympathetic activation also increases conduction velocity, particularly at the atrioventricular node. Remember that there are beta receptors found throughout the myocardium in the atria and ventricle as well, but the key antiarrhythmic property of the beta blockers is their ability to block this sympathetic activation of the SA and AV nodes. Notice the two musical notes on the heart-shaped music stand to symbolize the cardiac nodes, where beta blockers exert their antiarrhythmic effects. Think back to the sympathomimetics video at the Beta Band Camp. Activation of beta receptors leads to an increase in cyclic AMP levels, hence the camp in the band camp. Well, blocking those beta receptors at the nodes will cause a decrease in cyclic AMP levels as depicted by this torn band camp poster hanging on the back wall. This leads to the closure of membrane calcium channels, important for the upstroke of the nodal action potential. These antagonized calcium channels will be symbolized by these empty crushed cartons of Calci-Yum ice cream, littered on the ground of this dilapidated jazz club. I want to emphasize that we have shifted focus away from that classic cardiac action potential discussed in the type 1 antiarrhythmic sketch, where the upstroke was determined by sodium current. We are now interested in the effects on the action potential in those cardiac nodes, where the upstroke is all about calcium. So take a look at the piano keys. After an action potential occurs at the node, and the cell is repolarized, ion channels open that conduct slow inward sodium currents, causing the cell to slowly depolarize. This slow, spontaneous depolarization is what initiates phase 4 of the action potential. As the cell depolarizes further, calcium channels start to open up, including those L-type ones that we discussed in the calcium channel blocker video. So again, just imagine this gradual depolarization as she slides her hands across the keys of the piano. Once the cell is sufficiently depolarized, the calcium channels open in full force, creating the phase 0 upstroke of the nodal action potential. This is symbolized by this upstroke of the piano keys. As the keys slump back down to their resting positions, potassium current dictates a phase 3 repolarization back to below threshold, much like in the cardiac action potential, where we had drawn in that potassium banana curtain, bringing the action potential to a close. Look closely at how Beta Fitzgerald is affecting this action potential. As she slides her hand up the keyboard, she pushes away that upstroke of the keys and prolongs phase 4, the baseline phase of slow spontaneous depolarization. This decreased or prolonged slope of the phase 4 pacemaker activity manifests in the SA node as a decreased sinus rate and helps to suppress any abnormal pacemaker activity. It's the AV node that's particularly sensitive, however. The prolonged phase 4 causes a dramatic prolongation of AV nodal conduction time and effective refractory period. See the heart-shaped light hanging on the back wall of the club? While it had previously lit the stage for some of the most famous jazz musicians of the era, it now hangs worn and broken, a symbol of the declining jazz culture. The bottom half of the heart hangs separated from the top, a symbol for the decreased conduction from the atria to the ventricles, due to suppression of the AV node. Beta blockers are particularly useful for treating supraventricular arrhythmias. Therefore, we've made the top of the heart still lit up, indicating the importance of beta blockers to suppress arrhythmias originating in the atria. Also, let the IV on the sign represent the importance of the IV beta blockers, such as esmolol, in treating intraoperative or other acute arrhythmias. By depressing conduction through the atrioventricular node, beta blockers can potentially cause heart block. The recurring sketchy symbol for heart block is a heart-blocking shield, depicted by the top of Louis Armstrong's hat as he holds it against his chest. As a result, beta blockers can lead to a serious bradyarrhythmia in patients with an underlying AV conduction defect, especially if the patient is also receiving another agent that impairs AV nodal conduction, such as digoxin or a calcium channel blocker. Remember that heart block manifests on the ECG tracing as a prolonged PR interval because it takes a while to reach that ventricular QRS complex. To remember the PR interval, we have this public relations manager from the Beta Brass Club announcing the news of this once-in-a-lifetime benefit concert. There are a lot more side effects of beta blocker therapy, so check out our beta blocker symphony sketch for more info. A specific supraventricular tachycardia that can be treated by class 2 antiarrhythmics is atrial fibrillation. So let's bring back our recurring sketchy symbol for AFib, an irregularly irregular static signal on a television screen, this time hanging from the ceiling of the club. Recall from the Class 1 antiarrhythmics video that those Class 1C drugs were useful for treating AFib as well. In that scene, we illustrated a hotel resident pointing a remote at the irregular static screen, depicting conversion to a normal sinus rhythm. However, the first goal of treatment of AFib is not rhythm control, but control of ventricular rate, which can be accomplished by beta blockers. When too many signals from the fibrillating atria are sent to the ventricles, this can lead to tachycardia, called a rapid ventricular response. By increasing the AV node refractory period, beta antagonists slow ventricular response rates in atrial flutter and fibrillation. Let this rate-controlling metronome sitting under the TV remind you of the use of beta blockers specifically for rate control in AFib. Alright, the performance is about to get underway, so let's quickly recap the type 2 antiarrhythmics. Beta blockers don't modify ion channel function, instead they prevent beta adrenergic stimulation. This is most important at the SA and AV nodes, hence the cardiac notes on the sheet music. Inside the nodal cell, beta blockers decrease cyclic AMP, and this leads to a closure of membrane calcium channels, hence the crushed cups of calcium ice cream. The shape of the keys depicts the nodal action potential. Sodium channels and calcium channels are responsible for a baseline of slow, spontaneous depolarization until the phase 0 upstroke, which is all calcium. Remember that Beta Fitzgerald slides her hand down the keyboard and pushes the action potential away, depicting prolonging the slow depolarization phase 4. The AV node is particularly sensitive, leading to a dramatic decrease in conduction time, as the disconnected stage lamp suggests. This can lead to prolongation of the PR interval and other kinds of heart block. Class 2 antiarrhythmics are useful for treating supraventricular tachycardias, including AFib with rapid ventricular response. Slow down conduction to slow down heart rate. This does not fix the atrial fibrillation. This is merely rate control, hence the rate controlling metronome. Well, that's it for Class 2 antiarrhythmics. On to Class 3, where we'll get a little more Spanish.